I think one of the reasons I'm here is that a committee I co-chair called the the Canada Science and Policy Committee to Exit the Pandemic last week released actually a comprehensive plan of exit for the country. And I'll start with that. Under the aegis of the Institute for 21st Century Questions, we brought together leading scientists and doctors and leading policy people across all the disciplines, across all of our huge country to map an exit. And the diagnostic for that committee is that when we started in March 2020 in the pandemic, at least in Canada, we all of a sudden declared that the science is in charge, follow the science. Whereas most people would understand that the scientists were at the margins of public policy decision-making for all of Canadian history and to that moment. I worked for 3 different prime ministers, nonpartisan in the Privy Council office for half a decade. The scientists never spoke. And science was too marginal. All of a sudden, it took pride of place. It had monopoly and veto power over all policy decision-making for 2 years and continues to be so. The problem is, of course, that the scientists, the scientific class, starting with our doctors, are clinically excellent. They're excellent scientists, but to be direct, and I've told them as much, they stink at public policy. Public policy is its own craft. At the same time, the public policy specialists in our country, the economists, the social scientists, the education specialists, have limited literacy in science. So you had a total divorce of disciplines, but the scientists were doing decision-making in education, in economics, in border policy, national unity policy, social policy, way beyond their ken. So in this committee, we turned on its head this idea of follow the science. The science must input into a policy synthesis. But COVID is not a research project. And to your question about how others have treated it, the ones who have done better, and there are many, did not treat COVID as a science research project. They understood that COVID is an input amongst many other systems that need to be managed in a complex country with proportionality. So in the committee, we bring back that proportionality back together. It's a policy lead, and properly science feeds into it. So science is followed as an input, and it is not the virus is in charge. Other countries that have done better had a systems understanding of the problem. And that is what I want to impress on your distinguished audience and our listeners here. COVID is not the center of the world, never was the center of the world, never will be. It is one of many phenomena that are affecting our society. We actually have 8 systems crises in the country, 8. And COVID increasingly becomes the minor one. What are they? COVID public health, non-COVID public health, the economy and business, education, catastrophe, I want to speak to it in a second, national unity, deteriorating social fabric, and international weakness. All of these are COVID and pandemic caused national crises. And when I mean system, we must imagine 8 balls in the air at the same time in Canada, because it's a huge country with regional differentiation across the 2nd largest country in the world. If any of those systems collapses, it causes more death in toto than COVID could ever have. If the economy collapses in toto, we're dead in huge numbers. You see that in Ukraine now, or you could see it in Russia. If the national unity of the country disintegrates, if Quebec secedes or the West secedes or something else, the country disintegrates. That's much more death in the end than COVID. So all of these things need to be kept at the same time. There can be more an accent on COVID at one point, but the exit, therefore, is not just removing the mask and the mandates. That is all key, but it is on all 8 systems. So the exit plan, I'll feed it to the listeners, is actually an 8x21 matrix that we put together across all the regions of the country. The exit must be extremely high energy. Now on Twitter, we can imagine saying, I'd like to take it gradual, I'm Canadian, let's take off our mask when we feel comfortable. The problem is that if you take off your masks and remove the mandates gradually, there are still hundreds of thousands of businesses that disintegrated. There's still 200,000 plus children across our country who are not in any school at all. We call them 3rd bucket kids, 0 school. I mean, they're in the Oliver Twist condition. They're not being homeschooled, pod schooled on the street or somewhere in some dark corners. National unity will continue to disintegrate. So exiting COVID requires on all systems high energy at the front. Mask off, vaccine mandates out. We're into the street. We're rebuilding the country. And we're managing public health as we go with all the other systems. Countries that have understood that, including Sweden, including, by the way, Ukraine and Russia, strangely enough, some of the Northeast and Southeast Asian countries, many countries in the Middle East and Africa and the Americas, they all did not collapse their systems to the same degree. But when we exit, we must imagine it's not a tweet. It is full-on system-wide exit with high energy, because we have a country to preserve.